Thanks for putting well. I am Dr. Milind. So INICET May 2023 is just around the corner, and there is one question that troubles most of the aspirants, and especially those who are attempting exam for the first time. That is, how many questions to attempt in INICET exam. And I just would like to share a few tips which will help you in attempting this paper. So let's start today's video. So first of all, let's get familiar with the marking scheme. I'm sure you all are aware of it. So there will be 200 questions, and you'll get around 180 minutes. That is 3 hours, and it is mainly objective type of questions. You'll have a lot of image based questions, you will have clinical based scenarios, assertion and reasoning. So it will be a mixed back question, and for the correct answer you'll get +1, and for incorrect answer there will be one third mark will be deducted. Now to know about whether unanswered or marked the questions which you have marked for review, whether they will be included in the evaluation or not. Whenever you get those 10-15 minutes prior starting to your exam, there will be all instructions whether they are included or not. Usually they are not included, but you should read those instructions carefully, so you don't panic in the end. In case you tie with other students, so the first resolution of ties by the student who has less negative mark will be placed higher, and if that is also the same, then the candidate who is older by age would be placed higher. Now if you are someone who is just looking for a number, and that, just tell me what is the number of questions that I should attempt, I'll say between 175 to 185 is a safe number. But in any case, do not attempt less than 170, because it's not number, like there is no set mark criteria or or a question criteria that if you score about that your selection is fixed. Your selection is based on how your competitors will perform. So you have to attempt more. If you look at the toppers, if you have seen old interviews, and I have interacted with a lot of students over the last 4 5 years, and what I have noticed, and even myself, we have attempted more than 190 questions. So that is what most of the toppers do. There also is, as you say that, some students want to play safe. Like if you're someone who is looking for a safe branch, like for example now we have more number of INIs, and if you're looking for some branch that you'll get between 200 to 1000, and you don't want to spoil your rank, if you're scared of a lot of negative marks, then I'll say you should attempt somewhere between 170 to 185 instead of going more than 190. So it's your choice as well, but as I have said, do not attempt less than 170, because your competition is going to be there. Now, why this makes sense? Because if you look at the rule of probability, so as I said that, you're going to get in the 25% of the time you're going to be right if you're going to guess the answer. So if you attempt 4 question, if you get 1 question right, your score will be, you will not lose your baseline score, but definitely this will increase your more negative marks. And if you tie, then you will end up being at the lower side of the list. So now a lot of students ask me, sir, why not only mark confirm answers? Then if I have 200 questions, then why should I go for the attempt those questions which I am not sure of, or which I don't know? See, I'll tell you something. There are few things, especially for INI, which affect. See, there are some clinical scenarios which might have two answers. For example, it depends on the person who has said that question paper, and it is not true for all the questions. But definitely there are some scenarios whether one physician will might to choose a different path, and another physician might choose a different path. So that might be there. Also reference material can vary, so maybe you will feel that your answer is wrong, but that might be right. And also it can happen vice versa. Also what happens sometimes that you think that you're right, but sometimes, especially for INI, they have a lot of twist, they have a lot of tricks in their question. So sometimes you misread the question, or sometimes your interpretation is wrong, so you feel that you're right, but that's not the case. Also sometimes you have recall errors and some confusion, so you feel that you have marked the correct answer, but when you come back you realize, okay, it's not the correct answer. So that is why I do not advocate that, that you should only mark confirm answers and come back. You have to take risk, as it's a competitive exam. Yeah, definitely there is a number. Till then you have to, give your best. After that you have to take chances, and you have to use reasoning as well. Also, as I have said, now the number of your competitors are attempting throughout the years. We have seen INICET, all the toppers, most of the students, they attempt more than 190, 185 questions. So that is the reason you have to go beyond the answers that you are confirmed sure of. Finally, see, INICET is, I always say, it's 50% preparation and 50% how you attempt exam. Even if you are not happy with the kind of revision you have done, even if you feel that you have a lot of lacunas, a lot of deficit in your preparation, still go and attempt a good paper. And trust me, I have seen miraculous results with students. Try to attempt more than 185. Even if you can rule out one option, if you feel, if you're able to rule out one option in any question, attempt that, because you will have this confusion. If you have to leave like 10 15 questions, but don't leave those questions in which you are able to at least rule out one option. You have to go for that. Secondly, don't overthink. A lot of students, when they attempt INI or AIMS kind of exam, they feel that they are going to ask us very hi-fi question and very difficult question, but that's not true. You don't have to overthink. Also, a lot of students, they spend a lot of time on a single question. See, you have to attribute particular time for a question. If you spend more time on a single question, and that is the reason a lot of students have managing difficulty in managing time. So if you're not sure about the question, if you feel difficult, okay, I'm not able to reach the answer, leave it and move on to the next. Always see what is common. See, you don't have to be always think about all the syndromes and the questions which are very rare. You have to first go for what is most common and more logical answer. Don't go for rare possibilities. You see, most of the times they want to see whether you are aware of the current scenarios or not. So don't be very impulsive when you attempt your paper. Also, when you start your exam, sometimes you'll get tough questions like ophthalmology in AIMS, especially very in INIs is very tough. So don't be disheartened if you get those questions, because you have 200 questions and out of those only 150 will decide your fate. 20-30 questions nobody will be knowing, and that will be difficult for everyone. So don't worry about, if you get difficult questions, don't be disheartened. You have a lot of questions. So guys, I hope this video will help you. I wish you all the best for the exam, and I hope your dream will come true. Take care.